Hello friends, welcome to the channel Dewdear Academy. In this video, I am discussing a Kerala PSC DHS exam question. The question is, the ego defense mechanism in which unconsciously discharging pent-up feelings to a less threatening object is called. So the question is from the topic ego defense mechanisms. So the question is, the unconsciously discharging pent-up feelings to a less threatening object. Which is the defense mechanism in which we are unconsciously discharging our feelings, pent-up feelings to a less threatening object. Now we understand the question now. So these are the key points in the question. Unconsciously discharging our feelings to a less threatening object. The options given here are repression, denial, displacement, conversion. So which is the correct answer here? Options once more: repression, denial, displacement and conversion. So we will discuss all the options first in detail. What is repression? Yes, repression means it is an unconscious defense mechanism in which the mind pushes our distressing memories, thoughts or desires out of conscious awareness. We are trying to push our distressing thoughts and memories from our conscious awareness into the unconscious state. That is repression. The person does not recall or assess these repressed feelings because we are trying to bury that in our unconscious. So that is known as repression. All the memories, thoughts or desires which we find as difficult or distressing, all those things or all those memories, we are trying to bury that into the unconscious state. That is repression. Something like example, a person who has gone through a traumatic experience, so they may not have any memory of it because it has been repressed. So that is repression. So the question here is, we are trying to discharge the feelings to something else. So is that the same? No. So this option is not the correct answer. Next option we are taking, that is denial. What is denial? Denial means refusing to accept or acknowledge the reality. We are not trying to accept the reality or fact because they may be threatening or uncomfortable. So we are trying to refuse to accept the reality. The person ignores or denies an unpleasant truth, preventing it from entering the conscious awareness. So that is denial, not trying to accept the fact. That is denial. So the question, the answer or this topic does not match with the question given here. Okay. For in the example of denial is that if someone who receives a serious medical diagnosis may try to deny the diagnosis, refusing to believe it or accept it as real because it is uncomfortable, it is a threatening for them, so they don't want to accept it. They try to deny the medical diagnosis, which is very serious diagnosis. That is denial. So that is not the correct answer here. So just I'm crossing that. The next is displacement. What is displacement? That is an ego defense mechanism where a person unconsciously redirect or discharge their feelings such as anger onto a less threatening or safer substitute object. That is unconsciously redirecting or discharging their pent-up feelings onto a less threatening or safer substitute object. So this is happening when the true feelings or true target of the feelings is too threatening or if it is unacceptable for them. So the mind divert these emotions to something else or someone else. That is displacement. For example, someone who is angry at their boss. They will try to, or they may go home and they take out their frustration onto a family member or to a mother. So they feel safer than confronting the boss. So they try to displace that emotions to their mother. Okay. For example, I will tell once more the example. The someone who is angry with their boss, trying to take out their frustrations and emotions onto a family member, considering that it is safe rather than dealing their boss, it is safe to confront it at home or deal it at home. That is displacement. So that is the question given here, unconsciously discharging the pent up feelings to a less threatening object. So the correct answer is displacement. Displacement is the correct answer, because it is the mechanism in which the feelings are redirected from a dangerous or unacceptable target to a safer or more acceptable one. We are redirecting from a dangerous target to a safer or more acceptable people or object. So that is the correct answer. And we have one more option, that is conversion. What is conversion? Conversion involves transforming the psychological distress or mental conflict into physical symptoms. Often involuntarily we are doing that. Transforming the converting means we are transforming our distress or mental conflict into physical symptoms. A person under the intense stress may develop symptoms like paralysis, blindness or numbness without a medical cause. That is mainly occurring due to conversion. Without any medical cause, they may exhibit some of the physical symptoms if they are in stress. That is an example. Conversion means displaying some of the physical symptoms because of the psychological stress or mental conflict in them. So that is also happening involuntarily. That means the person who is under stress may develop some of the symptoms like numbness or blindness without a medical cause, can be due to, that is known as conversion. So that is not the correct answer here. So the correct answer in this question is option C, that is displacement. Displacement is the mechanism in which the feelings are redirected from a dangerous or unacceptable target to a safer or more acceptable one. Or it is a defense mechanism where a person is unconsciously redirecting or discharging their pent up feelings onto a less threatening or a safer substitute object. So this video is regarding the defense mechanism. All the defense mechanisms are very, very important. So try to learn all the defense mechanism with examples. It will be helping you to prepare for the different examinations. So I hope this video is useful for you. Thank you all of you.